Okay.
Okay? This is her brainstem. So what happens is she has an abnormal with this brainstem that it falls below. This is her foramen magnum, the opening, okay? Hers falls a little bit low. These are her tonsillar areas I was talking about. So when it falls below, it's getting squished, okay, by this opening. So this opening is also a little smaller with her brainstem falling out. It shouldn't be like that. So it's putting pressure on this. She's having pain. So what happens is what we do is you literally go in here and shave this off. Okay, so this is like, you know, a cement box that's pushing on the brainstem that's falling through her foramen magnum. We shave it off. All of a sudden it pops up. Now she also has the C1 and she has what is called a cervical medullary band that's on here, and it also pushes down. So we just cut it off. It's like a rubber, just like a really thick rubber band. Cut it off. We open this area. You still have your it's called the dura. It covers the spinal cord in the brainstem. It's a little piece of paper, like it looks like a thin piece of paper. We cut it and we open it up. So now there's this opening, which is good because now she has flow. So we make a little patch in the dura, and then we replace it with a patch that kind of lets the...
It's more flexible.
Yes. So this shaves off. There's a little coating and a band over here. We take it off, and then we sew it to the normal. We make a little patch to make it more flexible so it has flow, like it almost pulsates because it's been pinched off for so long. And that's what you'll have. She'll just have that.
Okay.
So what we do is, so you know, you're losing a little CSF lead or flow because CSF flows from the brain down to the spinal cord and everything. So that's why they have a headache sometimes afterwards. Usually I keep a nice, cool, quiet room afterwards. Just have them kind of lay 30 degrees, and then the next day slowly get up. Everyone's different. Some people, I mean, basically they progress about 3 days just because they have a headache. You're not going to see symptoms overnight.
Okay.
Not at all. It's sometimes the headaches are worse for a couple weeks.
Okay.
Because, I mean, this is from birth, so it's not going to be corrected overnight. Once your body gets used to the flow, it does better.
Okay. So right now, what's her flow look like?
I don't know. I didn't see the patient with him. I'm sorry. I know she's symptomatic of her flow. Velocity. So she has a small posterior fossa opening. So increase. So she has an increased flow because it's working harder to get past that roadblock.
Right.
So we want the flow to just
Be able to flow freely.
yes.
Yeah, at a normal rate.
Yes.
Okay.
So it's something.